Hospitals in Gauteng are experiencing an increase in admissions. The country is seeing a huge surge of Delta variant infections, and this is believed to be the cause of the high number of admissions. Well, let's chat about it now with Dr. Ntsakisi Maluleke from the Gauteng Department of Health. Doc, a very good afternoon, and thanks so much for your time. Just looking at the numbers that you've been talking about, Gauteng reaching more than 90% COVID-19 bed occupancy. Are we in crisis now in our hospitals here in Gauteng?
Good afternoon. It is indeed an open secret that the Gauteng province is the epicenter of this current wave. And as far as bed occupancy in the public sector is concerned, we are sitting at 91% of bed occupancy, and the private sector, is sitting at 94%. What we've been doing as both private and public is using a risk-adjusted approach to increase the number of dedicated COVID-19 beds that are available on both health sector systems. I'll speak particularly to the public sector. In the public sector, we have built 3 facilities since March last year, at Chris Haribara, at Jubilee, as well as Dr. George Mukari. And we also have the donation from BMW in Bronkhorstspruit and Tshwane, as well as the Hospital of Anglo-Gold Ashanti in Carletonville, in order to increase capacity for the public sector. From the 18,000 plus beds that we have in the public sector, we have repurposed 4,050 beds that are dedicated particularly for COVID, and we continue on a daily basis to repurpose additional beds as the need arises.
Well, Doc, you speak of the Anglo-Gold Ashanti Hospital. Now, I just read a short while ago that there are people out there saying that this hospital is actually not being utilized at all. So what is actually happening there? Also added to that, why not reopen the field hospital at Nasrec if we are in such dire need?
The Anglo-Gold Ashanti Hospital is in use. We have given the facility budget to be able to avail 40 beds currently as quarantine and isolation beds. Facilities have been transferring patients to Anglo-Gold Ashanti, especially in the West Rand, which currently has pressures at Lerato. The West Rand, I will just give a note that they have 99% of bed occupancy currently. So they've been using their sister hospitals, so including Dr. Yusuf Dadu, Carletonville, and also Anglo-Gold Ashanti. And the question of a reopening of Nasrec, it's the decision that has been made by the department to rather use in-house beds, which are available across the province. And as I've said, we are repurposing additional beds as the need arises. So those 595 beds that were at Nasrec have been decommissioned but spread across the facilities that are currently on ground in the province.
Okay, so you've taken, if I understand you correctly, all the equipment, the beds that would have been needed there, and you've distributed them to other hospitals. So that's where they're in use, if I understand you correctly.
That's correct.
All right. So we also understand that you have added that more staff have been added as well. You've managed to distribute staff as well to places in need. But of what use is that then if we are going to run out of bed space? Where will they be treating people?
One of the things that we have done is stopped non-essential medical services. So remember, the department doesn't only cater to COVID patients. We do have a number of non-COVID functions that still continue during this period. But as far as elective cases are concerned, we have stopped them for this period in order to be able to avail the beds that patients would have been occupying post-operatively, particularly for COVID. Staff is needed to man those beds. We have received staff from the South African National Defence Force. We've also received funding to be able to increase the staff on the ground, especially in the new facilities, those ABTs I referred to, as well as the Bronkhorstspruit and Anglo-Gold Ashanti facility. On a daily basis, we are recruiting based on budget that is availed as the need is increasing for additional beds.
Do you think that you're going to be able to carry on then, Doc, considering the numbers that we are seeing, the latest numbers, the highest we've ever had in this pandemic in the country, and especially here in Gauteng being the epicenter? How do you see yourselves coping going ahead in the weeks ahead?
I need to commend the countless men and women who are on the field, on the ground right now, working tirelessly to service patients who come in through our doors, either COVID positive or who are under investigation. As a department, we increase resources based on need, and what we've also been doing is we have daily engagements with the facilities to respond to the challenges that they have. And even today, as it being a Saturday, we are going to also be having engagements with the facilities to increase the human resource capital, particularly because that's been an area of concern. When looking at the patient acuity that we've been having in this wave, we've been in need of more ICU and high care beds, and we know that the nursing staff for these beds is a limited pool. We have a course where we've had a cohort, 2 cohorts actually, that have gone of generalized nurses who have gone through this training in order to increase capacity within ICU and high care beds. So as much as there's pressure, as much as we are overworked, and as much as we are tired, we continue to do the best we can with the resources that we have.